Welcome, everyone. Thank you for joining us for today's webinar. My name is Diana Echenique. I am a Senior Program Analyst, Hispanic Latino Communities at the Office of Minority Health Research Center, commonly known as OMHRC. The objectives for today's webinar contribute to disseminating accurate, useful, and culturally competent information for women living with HIV, and promoting resources molded to fit the needs of women living with HIV. Just a little housekeeping before we get started. If you have any questions during the presentation, please type them into the question box on the right bar of your screen. We will have time for questions at the end of the webinar. Please provide us with your feedback with the evaluation that will pop up at the end of this webinar. All participants who register for today's webinar will receive a link with the recording of today's webinar in a week's time. Next slide. Today's webinar, Supporting Minority Women Living with and Impacted by HIV, is in observance of National Women and Girls HIV/AIDS Awareness Day. The U.S. Department of Health and Human Services Office on Women's Health, the Latino Commission on AIDS, Samaritan Ministry Services of Women, and HHS Office of Minority Health Research Center will be presenting on why to focus on women and HIV, supporting minority women living with and impacted by HIV. Next, I would like to present our speakers. Ms. Adrienne Phoenix. She is a public health analyst, joined the U.S. Department of Health and Human Services Office on Women's Health in April of 2016. She leads one of OWH signature national observances, National Women and Girls HIV and AIDS Awareness Day. She works closely with other federal partners on the coordination of HIV and AIDS communication activities to support the implementation of the National HIV/AIDS Strategy for the United States, updated to 2020. Adrienne supports federal and non-federal partner and ambassador activities for WHS signature observance and works to support WH communication strategy to educate women and girls across the lifespan. Ms. Gabriela Santana Betancourt. She's the Deputy Director of Research and Evaluation at the Latino Commission on AIDS. Prior to joining the Commission, she worked with Planned Parenthood of New York City for over 6 years as research associate. Currently, she is completing her PhD doctorate degree in epidemiology at the County Graduate School of Public Health and Health Policy. Her dissertation looks at the impact of foster care placement on the sexual and reproductive health outcomes of youth in the child welfare system. Mr. Wayne Smith is the Director of Samaritan Ministry at the Central Baptist Garden in Knoxville, Tennessee, which he founded in 1996 in response to those suffering from HIV/AIDS and a lack of resources in his community. The Samaritan Ministry is an HIV/AIDS service organization that is Ministry of Central Baptist Church of Burden in Knoxville, Tennessee. This ministry provides care and support for people living with HIV/AIDS and other educational materials and seminars on the subject. Samaritan Ministry also offers HIV testing. Now, without any further ado, we welcome Ms. Adrienne Phoenix. Next slide, please.
Hi, good afternoon. Thank you, Deanna, for that introduction. I am excited to join today's webinar and give an overview of National Women and Girls HIV/AIDS Awareness Day, and also share some of the resources that our office has on women and HIV. Again, my name is Adrienne Phoenix, and I'm with the HHS Office on Women's Health. As Deanna mentioned, I'm the lead contact for National Women and Girls HIV/AIDS Awareness Day. This is just an overview of what I'll talk about today. I'll start briefly by telling you a little bit about our office, And then I'd like to talk about National Women and Girls HIV/AIDS Awareness Day and why it's important. And then finally, I'll talk to you about how we work with groups across the nation to support the observance. Next slide, please. Okay, so a little bit about the Office on Women's Health. OWH within the U.S. Department of Health and Human Services was established in 1991 to improve the health of American women by advancing and coordinating a comprehensive women's health agenda throughout HHS. As an office, we work to get the health of women and girls recognized as specialized issues that need and deserve attention, and we mean issues that are more than just reproductive health. Our vision is that all women and girls achieve the best possible health. Some of our goals are to inform and influence policies, educate the public, educate professionals, and develop and expand innovative approaches. Right now, some of our focus areas are health across the lifespan, emerging needs and unmet needs, health disparities, violence and trauma, obesity, and HIV and AIDS. Next slide, please. Okay, so before I jump into National Women and Girls HIV/AIDS Awareness Day, I prepared a poll question for the attendees. The question is, at the end of 2014, an estimated number of women in the United States were living with HIV. So your options for that number of women are 155,900, 255,900, or 355,900 women. Okay, it's looking like most of you got the correct answer. If we go back to the slides. The next slide, please. There we go. So the correct answer is, at the end of 2014, an estimated 255,900 women in the U.S. were living with HIV. This is new data that the Center for Disease Control released earlier this month, actually right before National Women and Girls HIV/AIDS Awareness Day. It's a fact sheet on HIV in women. I have provided it in the slides, and I encourage everyone to take a look at it. But I pulled this statistic out because the number is staggering, first of all, but it also speaks exactly to what I'm here to talk about, which is National Women and Girls HIV/AIDS Awareness Day. Next slide, please. Okay, so I hope that most of you are already familiar with the observance, but National Women and Girls HIV/AIDS Awareness Day is a national observance that's led by our office every year on March 10th. And this year, 2018, marks the 13th observance of National Women and Girls HIV/AIDS Awareness Day. This observance is really important because HIV and AIDS, as we know, are still widespread public health issues, and women still remain vulnerable to HIV. We just talked about that data point from CDC that in 2014, 255,900 women were living with HIV. Well, we also know that African American women and Hispanic women remain disproportionately affected by HIV. I'm going to give you two more numbers really quickly. African American women made up 61% of new HIV infections among women in 2015 in the United States. And in that same year, in 2015, Hispanic women made up 15% of new HIV infections. So what all of these numbers illustrate to us is that women are still being impacted by HIV and AIDS, and the goal and really our purpose for NAGA, or for National Women and Girls HIV/AIDS Awareness Day, is to shed light and to raise awareness of this impact that HIV and AIDS have on women and girls in the United States. Next slide, please. So I'll tell you a little bit about what we did for the 2018 observance. In order to support the first strategic goal of the National HIV/AIDS Strategy for the United States, which is to reduce the number of new infections and to help move the nation towards an AIDS-free generation. We use National Women and Girls HIV/AIDS Awareness Day as a platform to continue to focus on increasing knowledge around HIV risk and HIV prevention among women and girls. So for 2018, we set a new theme, and you can see it here. It's HIV Prevention Starts With Me. And we really wanted to focus on two things, on raising awareness among HIV positive and HIV negative women and girls about the steps that they can take to prevent HIV transmission. We want women and girls to know how to protect themselves and their partners from HIV, when and where to get tested, and we want to encourage them to talk to their doctors about how they can lower their risk, including by taking pre-exposure prophylaxis and post-exposure prophylaxis. The other thing we want to do with the observance is raise awareness among health professionals about the importance of talking with all of their patients about their risk for HIV and steps that healthcare providers can take to prevent transmission. Specifically, we want healthcare professionals to know what CDC's HIV screening recommendations are and to implement them as appropriately. And we want to encourage them to talk to their patients about how to lower their risk for HIV prevention, for HIV. So with this theme, HIV prevention starts with me, this theme really makes the risk of HIV immediately relevant to all of our audiences, and it really drives home the point that everyone has a role to play when it comes to preventing HIV. Next slide, please. So this is what we do and how we get our supporters involved. We rely heavily on federal partners and national supporters to help us spread the word about the observance and to help us raise awareness of the impact that HIV and AIDS have on U.S. women and girls. The National Women and Girls HIV/AIDS Awareness Day website is the focal point of the observance. We update it every year to reflect the new theme, and we update the health information that we have on the website for women and girls. We have two sections, what every girl needs to know about HIV and what every woman needs to know about HIV. The website is also where we provide downloadable and shareable resource materials in both English and Spanish. That includes two fact sheets. There's a fact sheet on women and HIV, and there's a fact sheet about the observance. We also provide graphics and messages for social media, as well as a list of ideas for observing National Women and Girls HIV/AIDS Awareness Day in your community. And I will say that list is pretty extensive, and anyone who's looking for ideas of ways to support the day in their community, I think, will find it helpful. And the last thing that we feature on the website is a link to CDC's Get Tested web tool. I hope you're all familiar with it, but this is where anyone can go online, enter their zip code, and find a HIV testing location in their area. So to kind of help us meet these goals as we plan for the day, we engage and reach out to national organizations and ambassadors who already sort of resonate with our target audiences and have a broad appeal, and they're advocates or advocates for HIV and AIDS awareness. And we ask them to work with us on social media, interviews, blogs, and other promotional activities to really kind of elevate HIV and AIDS as pressing issues for women and girls, but to also help us educate them on how they can prevent HIV transmission. And the last thing, and maybe even the most important thing that we do for National Women and Girls HIV/AIDS Awareness Day and throughout the month of March is we ask regional and national supporters, health professionals, community organizations to help us support women and girls impacted by HIV and AIDS. We encourage our supporters to visit the website, to join a conversation online using our hashtags and participate in our online activities like our Thunderclap. And we also ask them to share our resources with their networks. And all of this with the goal of helping us increase awareness around this important day and increase awareness around this important issue that we know is still impacting women and girls in the United States. So that's all that I have for National Women and Girls HIV/AIDS Awareness Day. Hopefully you found the presentation helpful, or that we've sparked some ideas about how you and your organization can support the day and can support women and girls in your community when it comes to HIV and AIDS. So I've provided a list, some resources that I used earlier in the presentation. You'll also find a link to CDC's Get Tested tool, our website, and the National Women and Girls HIV/AIDS Awareness Day website here. Next slide, please. This is where you can find our office on social media. We encourage you to visit the website, to sign up for email updates, to follow us on social media for our latest updates on women's health. What's missing from here is Pinterest. You can find us on Facebook, Twitter, YouTube, and Pinterest. Next slide. And finally, this is where you can learn more information about National Women and Girls HIV/AIDS Awareness Day and how you can get involved. And I've also provided my contact information there in case you have questions about the day after today's webinar. Thank you very much for your time. Okay, and I would like to introduce our next presenter, Gabriela Santana Betancourt. She is the Deputy Director of Research and Evaluation at the Latino Commission on AIDS, and she'll be talking with us about Latinas and HIV.
Sorry, I'm not sure if you heard what I just said, but I wanted to thank everyone for inviting me to participate today in honor of National Women and Girls HIV Awareness Day. I'm going to be presenting specifically on Latinas and HIV. Next slide, please. So here's an overview of what I'm going to be presenting. I'm going to present on Latino Commission on AIDS trifold response to the HIV epidemic among Latinas, which include research, policy, and action initiatives. I'm also going to be giving you an overview of some data related to Latinas and HIV, and some examples of the responses that we've put forth, including a brief, our direct services, innovative approaches that we have, and community mobilization and advocacy efforts. Next slide, please. So just a brief overview of the Latino Commission on AIDS. The Commission is a nonprofit organization founded in 1990 to fight HIV, AIDS, in at-risk communities nationwide. The Commission provides services in more than 40 states, Puerto Rico, and the Virgin Islands. We have demonstrated a long history of building local, regional, and national coalitions. The Commission services model encompasses 5 core and complementary services that include Hispanic behavioral research, HIV prevention and health promotion, capacity building assistance, or CBA, HIV testing and access to care, and health policy and community mobilization. Next slide, please. So now that you've heard a little bit about where I am working, I'd like to know where you all are working. So please choose the response that best fits your current professional, academic, or service environment using the 5 responses on the slide for the poll. Great, so it seems like we're about evenly split between community-based organizations and health department as our professional or service environments. There's also about 15% of folks that are working with healthcare organizations, 10% that are working either at a hospital or a medical institution, and 27% that are working in some other environment. I'm hoping that the information you'll be receiving today will be applicable to you regardless of where you are currently working or offering services. Next slide, please. So this first section of the presentation is going to give you an overview of the CDC's HIV surveillance report from data collected from 2016, and it's volume 28. Next slide, please. This surveillance report was published in November 2017 and includes data as of 2016 for the US and 6 dependent areas, and includes diagnoses of HIV infection reported to the CDC through June 2017. Rates that will be provided on the slides are per 100,000 in the population. And it's important to think that from 2011 to 2015, the annual number and rate of diagnoses of HIV infection in the US decreased, but the rate increased for persons ages 25 to 29. The rates also increased for American Indian, Alaskan Natives, Asians, and Native Hawaiians, other Pacific Islanders. It also decreased for Blacks, African Americans, whites, and those individuals identifying as of multiple race, and remained stable for Hispanics, Latinos. Next slide, please. So we can see that despite some successes, disparities in the epidemic continue. Variation is notable not only across groups, but within. Next slide. On this particular slide, what we see is that there are disparities across groups. Disproportionately high rates among African Americans, given their percentage of the population, and in comparison to their white counterparts. We also see the burden of the epidemic disproportionately in the South compared to other geographic locations in the United States. Next slide, please. So looking at this slide, what do these numbers tell us? Latinos are overrepresented in diagnoses given their distribution in the population. Latino males, and specifically Latino MSM, or men who have sex with men, are disproportionately represented in relation to the national distribution. And Latinas exposed via heterosexual contact are also slightly higher than the national percentages. Next slide, please. As we can see on this slide, we also see that there are disparities across groups by place of birth. So we can see that variation occurs not only across groups, but within. Next slide, please. This data is taken from Table 14 of the HIV Surveillance Report, Volume 28, page 76. We can see that there are differences in transmission risks by country of birth and gender. For example, men who have sex with men, or MSM exposure, 66% among the Puerto Rican group, compared to 93% among the South American group, and compared to 85% of the total group. For women who have sex with men, or heterosexual exposure, 82% among the group born in the US, as compared to 90% and above for all other groups, compared to 88% of the total group. Next slide, please. Although there is a lot of data that I've been presenting, the information does beg that there's a need and gaps that beg for further understanding of individual, group, and environmental level variables. Our needs and gaps include a better understanding of relationship between country of origin, risk, and diagnosis, patterns of testing, including awareness of one's status, awareness of one's risk, as well as acceptability of testing, the interactions between age, risk behavior, social determinants of health, as well as structural determinants of health, and that further research is needed in areas of sex assigned at birth, current gender identity, and risk. This also calls for an equitable allocation of resources and that there are geographic variations at multiple levels: state, county, city, urban and rural, and the dependent areas of the territory, such as the case is with Puerto Rico. Next slide, please. Taking a local view, I've used the New York City Department of Health and Mental Hygiene HIV Surveillance Annual Report for 2016. And as you can see in this slide, in 2016, the diagnosis rate among Black females was 2.7 times higher than the rate among Latina Hispanic females, and over 14 times higher than the rate among white females. Next slide, please. We can also see that there is a disparity across HIV diagnoses among race, ethnicity, and gender identity, where transgender individuals are most vulnerable or at highest risk for diagnosis. Next slide. So I want to just take a moment to highlight a few key takeaways. One is the importance of knowing one's status, not just HIV, but also STI. The importance of awareness of the risk for HIV, STIs, and increased risk when diagnosed with one. The importance of knowing the difference between routine and targeted testing. The importance of knowing the accessibilities of services that we as CDOs may not be able to offer in-house, but may have in our wheelhouse through our navigators. And that we take into account that effective interventions found to work are holistic and take into account the promotion of a client's health and well-being. Our CDOs must be equipped to offer both arms of the HNS or HIV navigation services model, which includes both treatment and prevention. Next slide, please. So here's another question. I'd like to know what we all do. So what are some of the measures your organization has taken to respond to the needs described? Please check all that apply from the responses below. Great. So I see that 44% of you responded that at your organizations, you respond to these needs with health promotion or awareness efforts or initiatives. About 26% also are offering direct services, and 16% are engaging in research. About 5% are also engaging in advocacy or community mobilization efforts, and 9% of you responded other. Next slide, please. So I just wanted to share with you some of the efforts and responses that the Commission has engaged in. One is the recently released brief that highlights disparities and offers recommendations related to HIV among Latinas, both of cis and transgender experience. And the brief is meant to be disseminated among those of us in the field, but also with our consumers. And we took special note to use graphics that were easy to understand and illustrated. Next slide, please. The title of this was Latinas and HIV in New York City, an overview. The data that we used was culled from the New York City Department of Health and Mental Hygiene. And as you can see, we have information that's really just jumps out and is really easy to understand on the brief. Next slide, please. We took special note to look at differences across age, across transgender versus cisgender women, across race and ethnicity, as well as transmission risk. Next slide, please. And the final section of the brief offered 5 recommendations that could be easily implemented. Next slide. These recommendations were aimed at providers and highlighted the importance of acknowledging, understanding, and respecting our consumers and our community members. The recommendations were also offered to health policy makers, asking them to address social determinants of health. We also wanted to provide recommendations to researchers and the importance of documenting and building evidence to understand causal pathways between trauma and abuse and poor sexual health outcomes among vulnerable women of color. We also offered recommendations to funders and their funding streams to further allocate resources. And finally, we made recommendations to everyone, which is to work together to increase the availability, accessibility, and acceptability of HIV education, prevention, and treatment via advocacy and awareness campaigns. Next slide, please. At the Commission, we've also recently engaged in an innovative approach called Chicas Charlando. Chicas Charlando is a program of the Commission dedicated to giving women of color, especially Latinx women, a forum to discuss how race, gender, sexuality, class, and those intersectionalities affect our quality of life. It is a monthly webcast series with us discussing topics ranging from intimate partner violence to forming families. Our webcast last month was in honor of Black History Month. Next slide. And Chicas Charlando really came about as a response to the need for capacity building in CBOs and awareness building in CBOs among the intersections of women, of both transgender and cisgender women. Next slide, please. I'd also like to highlight the efforts that the Commission engages in as far as direct services. We've always had a history of services that were really tailored and focused on women, including Latinas por la Salud, Mujeres Unidas, and we recently received funding for an innovative program called the Mujeres Program, which is a program that seeks to engage Latinas of both transgender and cisgender experiences on PrEP and linking them to PrEP and navigation services. Next slide, please. Finally, our community mobilization and advocacy efforts include active membership and participation with various New York City Department of Health and Mental Hygiene groups at the local level. This includes the community engagement group that promotes sexual and reproductive health and reduces inequities using a justice framework. The Women's Advisory Board. We were involved in a PrEP campaign, and at the national level, we were involved in the Show Your Love campaign, which was through the University of North Carolina, and looked at preconception health. We're also involved in both national and local level awareness campaigns, such as the National Latinx AIDS Awareness Day, or NLAD, as well as NHAD, which is National Hispanic Hepatitis Awareness Day, and various PrEP campaigns at the local, state, and national level. And at the local level, we've worked strategically with partners that are the experts when it comes to women's health, including Voces Latinas and Iris House. Next slide. Here's an example of our most recent National Latinx AIDS Awareness Day which is on October 15th every year. NLAD was established in 2003, in response to the impact of HIV and AIDS among our community members nationwide, including the District of Columbia, Puerto Rico, and the U.S. Virgin Islands. The Commission, in conjunction with local, regional, and national partners, actively participate in the planning process and can assist you with any requests you may have organizing your local or regional events. As you can see from this poster, we really take note in representing our community and the diversity of it across age, across race and ethnicity and gender, taking into account that Latinos are not monolithic. Next slide, please. And here you can see references and resources. Many of these are available to you by downloading for free that were used throughout the slides. Next slide, please. And I just want to take a moment again to thank everyone, to thank the Office of Minority Health and my co-facilitators for allowing me to participate today. This is my contact information. Please feel free to reach out with any questions or concerns that you may have. Next slide. And now I'm happy to pass on the baton to Mr. Wayne Smith, who is the Director of Samaritan Ministry Services for Women in Tennessee. Take it away, Wayne.
Thank you so much. It's great to be a part of this informative webinar, and want to thank the Office of Minority Health for making this possible today. My part in this webinar is probably designed to bring attention or some thoughts and ideas from a very small, more rural organization, which is what we are. We are located in East Tennessee, which is an area where population is mostly rural except for Knoxville and Chattanooga in the southern part of the state, and then Johnson City and Kingsport, but lots of rural areas. We're a small agency located in Knoxville, Tennessee. Next slide. So a little background for you in terms of where we are. We have a very undiverse, if there's such a word as that, area in East Tennessee. It's very white. Our minority populations are small here. And given what you've heard about the disproportionate effect that HIV has on women in particular, women in general, and minority women in particular, we felt like it was important for us to work hard, given the demographics locally, to reach those women and those minority women, especially in our community. There's a lot of stigma associated with HIV in the minority communities here, and our Hispanic folks in many cases are hard to reach. Trust levels are low, and many of our locals are undocumented. Next slide. So again, this is what our population looks like in Knox County. So you can see that we have challenges here if we're wanting to really get the word out to some of our minority groups that they're small, and it will take some effort in order to reach those groups. Next slide. This is a graphic demonstration of the people that we are able to reach, our clientele, the outreach programs that we do with HIV testing, and who we're reaching. And you can see that the number of African Americans that we're reaching in terms of our total outreach is much greater than the population locally would indicate. So we feel like our strategies are working, and we're making pretty good inroads into that community. We're holding our own with the Hispanic community, but certainly not expanding on that as much as we are with the African American community. Next slide. In terms of gender, we see about a 50-50 split here between the numbers of males and females that we're reaching in our community. Next slide. Again, we feel pretty good about that outreach because in general, females represent a pretty small portion of the total number of people living with HIV in East Tennessee. So again, our efforts are trying to reach that smaller group and have impact on that group that, according to its numbers, is much smaller than the male group, and we feel like we're making some progress there. Next slide. So here's a poll question for you. What do you think is the greatest barrier for minority women seeking HIV testing and care? Well, those are great answers. Thank you for taking the time to give us answers in your poll. I would agree that stigma certainly stands out as the major barrier. I think you're right on target there. We see, in addition to these four issues, we see among our minority women a lot of isolation, which goes hand in hand, of course, with stigma. And in our community, unfortunately, many of our minority women who are living with HIV also live close to or below the poverty line. So I would certainly say that those two factors stand out. Mental health issues also seem to have a place in this whole picture, as does substance abuse. Next slide. So our strategies that you see here are things that we've developed or worked with over a number of years, and I want to just share some of this with you. The first two go together, I guess. We have a lot of women that we work with in the community that just find it very, very difficult to get out. Simply put, they're tied with family, they're tied with lack of transportation. We don't have a great public transportation system in Knoxville because of the size of our city. And so when we provide events, support groups, things like that, health fairs, classes, it's very difficult for our women to get there. So we really do go get them. We have a van, and we have church partners in our community that help provide vans, and we go get our folks so they can come. And that really has been a big factor in getting some of our women to participate in our programs. Having a safe setting for people to come where they feel warm and welcome is important. Providing translators is something we've learned has been a big strategy for us. One of the things that we do out in the community with our Hispanic population is work with migrant farm worker communities in rural East Tennessee, and translators are very important. And we have been surprised at the diversity of our Latino neighbors that come in to do migrant farm work. They certainly represent the full gamut of countries in Central and South America and Mexico, and translation can be a real challenge. We find that fun and food matter. When we provide food for people and make our events enjoyable and fun, then people come. And that's been a real important part. Working in the HIV/AIDS community, we can be perceived as the Debbie Downers of the world. You know, what would you rather do? Go anywhere or go to something that has to do with HIV/AIDS? And so we find that having fun and food really makes a big difference. And we have worked very hard to engage our community, especially our faith community. We have many partners in this community, other churches that provide help and assistance so that we can do the work that we do. We are a part of a local Baptist church here in the community. Samaritan Ministry is not a 501c3 organization. It is an outreach arm of our local Baptist church here in Knoxville. Next slide, please. One of the big successes that I think that we've had reaching especially the African American faith community has been through an organization that we're a part of called the Faith Coalition. This coalition was actually convened by the Knox County Health Department, and it's an effort to reach out into the African American faith community, provide training, support, events. We recently had very successful events surrounding the National Week of Prayer for the Healing of AIDS. We had 106 church leaders from various church denominations come to participate in early March. This picture here is a training that we did for church leaders about a year ago, and we're just excited about the inroads. We have had some very, very courageous African American pastors step up to the plate and really speak out about stigma and HIV in church, and it's made a big difference in our community. We are very proud of these efforts. Faith Coalition is an affiliate organization of the Balm in Gilead, which many of you may know of, and I would suggest you look at Balm in Gilead on the web for more information. Next slide. So our model is pretty simple, and I've explained some of this already to you, but we do provide monthly support group meetings for women only. This is a small group, but it's a small, intimate group that's gotten to know each other well. The ladies that attend this group represent a pretty good age range. They represent a variety in terms of race, background, and they count on each other for support. I'm going to talk about a couple of these ladies in just a few minutes. We provide transportation for our ladies to come to this group if they need it also. We provide food deliveries toward the end of the month to about 50 families in our community. Someone very wise told me recently that sometimes there are more days in the month than there is money in the month, and so we find it very important to help people at the end of the month make it through just those last few days. We have two events that we do annually. One is a Thanksgiving banquet that's always on the Thursday before Thanksgiving, and we do a summer cookout the first Tuesday in June every year. Together, these events bring in about 300 people for food and fun, as I mentioned earlier, and we really work hard to make these events just pleasant, warm, fun, and not about HIV, but about family and community. At our Thanksgiving banquet, where we serve about 250, we see lots of people bring families, parents, children, and it's an exciting time and something that our community counts on. We also work hard to partner with some rural medical providers that specialize in working with this farm community that we see, this transient farm community, and we also partner with a local Hispanic center here in Knoxville. Next slide. So I would like to just share with you a little bit some of the experiences that we've had with three of our women that we work with. All three of these ladies are African American. Rhoda is about 40 years old. She's independent and successful. She has worked hard to support herself and to manage her HIV disease over probably approaching 30 years at this point. She has done well with her health. She's very independent-minded. She's a go-getter. She takes care of her own stuff and her own business. And one of the things that has really stood out to me with Rhoda over the years is the support that she's had from her family, particularly her mother, throughout her struggle with HIV. We think this has been a critical piece for her to be the successful person that she has been. Rhoda actually adopted twins, a boy and a girl, about 5 or 6 years ago, and she's raising these twins. She adopted them as infants, and this is a testament not only to the changing face and world of managing HIV and her successful treatment, but she is really shows that the lifespan and the life expectancy, things that are changing with people living with HIV, especially women, has really changed, and we're very proud of Rhoda and the progress that she's made. Melba is a different story. Melba's a train wreck. She has a dysfunctional family, not a lot of support. She always faces difficulty with rent and utilities, having a safe, warm place to live. And really, she's that one step up and 2 steps back person. Melba doesn't have any issues with substance abuse, but stigma, I think, plays a large role in her life and how she manages. She's a hard worker, but she just can't seem to get ahead. Melba requires a lot of assistance from Samaritan Ministry. Alicia is another African-American woman who is probably about 55 years old. She's had HIV for a long time, and she probably is the poster girl for stigma. She has lived in many places in this country and has been an early victim of much stigma. She has no support whatsoever, and this has led her to deal with substance abuse on a fairly regular basis, and this has been her major difficulty. All 3 of these women tend to manage their HIV well, thanks to the Ryan-White system, and but for Melba and Alicia, it does seem to be more difficult than it is, of course, for Rhoda. We see a variety of people. We see people who have lots of different kinds of challenges and have different levels of support. And of course, it's our job to see how we can reach them and how we can assist them as they move along in their life, living, of course, living being the key word with HIV. Next slide. So based on what I've said today, what do you think is the single factor that contributes most to Rhoda's success? Well, again, bingo, you guys are right on target. Family support, certainly in the factors that I shared with you about Rhoda's life, family support was really the one that stood out. Can't overemphasize how much this seems to be true. I did not mention this, but I should have, and I will now. Rhoda owns her own home, and so she has a much more secure housing situation than do the other 2. So that really stands out. Of course, all 3 women are the same race, so that tends to not be a factor. Although I think stigma as African American women living with HIV certainly is a factor for all of them. I would rate transportation a little higher in here. I mentioned to you that that this is a difficulty for the women that I deal with in particular, and that's also a factor that Rhoda has a little bit more under control. She does have an automobile. Thank you for your responses. Next slide. So I've come to the end of this presentation, and I just want to let you have my contact information. On our website, SamaritanCentral.org, there's a variety of brochures, information that's available free that we've put together. One of the challenges that we've had at Samaritan Ministry is really to motivate and work with churches to get engaged in the right way to support people who are living with HIV, to support transgender community and the LGBT community. And so we think our materials lend themselves to that. How can the church be involved and engaged appropriately? So we invite you to look at those things, and certainly again appreciate the time that we've had together. Thank you for this opportunity to share with you about the work that we're doing in East Tennessee.
Next slide, please. Thank you. Thank you to all our speakers. And I am pleased to see that we have a number of questions, and we will try to get to each of them. The first question we have is, can we reprint and share with others the materials created by the Office of Women's Health?
Oh, sorry, I think you can hear me now. This is Adrienne, and the answer to that question is yes, absolutely. In my slide deck, I have included several resources on the last page. One of those is a link to the National Women and Girls HIV/AIDS Awareness Day website. You can find downloadable, shareable, printable resources there, like I said, both in English and Spanish. And thank you for that question. And yes, please, absolutely.
Okay, thank you. The next question is how the Baptist Church supports its efforts to provide services in the community.
We started this effort with our church about 22 years ago, really based on a story that came out of a Baptist minister's family in Texas, where in the early 80s, he found one of his sons was gay and had HIV, and his other son's wife had gotten HIV from a blood transfusion, and both grandchildren were infected. And so this was a story that was written about and had an impact in a lot of Baptist churches across the country. Our church, because of one of our ministers on staff at the time, just decided that we were a pretty large church and we could easily have a woman walk into our church with a couple of young boys that were HIV positive, and you know, how would we react? What would we do? And so our church just made it possible for me to do this work and for the church to be supportive of this through volunteers and the church budget going back many years. We've also been very fortunate to have many other partnerships in our city from churches across denominational lines to help us get the support that we need. It's always a challenge, but we're certainly grateful to our home church, Central Baptist Church of Bearden, to make this ministry work possible. I would like to add that on our website there are materials that are designed to help churches take a look at and take on this issue.
Thank you, Wayne. And there are two following questions. One is if the Baptist Church provide services free of charge, and do they also provide referrals? And another question is, see if you can address all of this. Do the women you serve, 46% of your clients, include transgender women?
Okay, good. Now go back and tell me what the first one was.
I'm sorry. So yes, does the church provide services free of charge?
Yes, okay.
And do you also establish referrals to, I
Right.
suppose, to other
Got-
critical care services?
Gotcha. Thank you. Those are good questions. Yes, all of our services are free. We don't charge for any of our services, and again, that's a testament to the support that we get from our community, so we don't have to charge for our services. We do a large amount of HIV and hepatitis C testing, and all of that is free to our community. We do refer. In Knoxville, we do not have one or more than one large HIV agency that provides all services. We have several smaller agencies, and so it really is important for us to have good partnerships to refer, and we work really hard with our government partners, our not-for-profit partners. We're not proud. We don't if people have the same goals, if agencies have the same goals that we do, which is to reduce the amount of HIV/AIDS in our community and help people live longer, then we want to be their partner. And we have some wonderful partnerships that we've established. So we make a lot of referrals because we don't provide direct medical services to people. So we do have to refer for those kinds of services. Let's see, the women that we reach, what was that last part of the question? I'm sorry, I forgot.
Yes, women you serve, 46% of your clients include transgender women?
Oh, gotcha. We don't have very many transgender women that we are serving directly at this point. We do have some partner agencies that are working with transgender women and making some inroads with transgender women, but this is one of the hardest groups for us to reach in our community. Unfortunately, because we're a faith-based organization, sometimes people make assumptions about who we are willing to serve. So we have to get people to trust us so that they can come forward. I would like to mention, because I don't know if this statistic was mentioned, but transgendered women represent one of the highest groups of people at risk for new HIV infections across this country. So that certainly is a group that we care about and would like to find ways to further impact.
Thank you, Wayne. And I don't know if Gabriela would like to expand on information and services available to this particular group.
Sure.
Gabriela, are you with us? Thank you.
Yes. Can you hear me? Okay, great. And
Yes.
I'm sorry for the background music. It's something that I unfortunately can't control because of where I am. But I'm really thankful that Wayne brought up that very important point that transgender women are at highest risk in a lot of ways because of various factors having to do with stigma, having to do with social determinants of health, and then the intersectionalities of having limited access to quality employment, for instance, possible co-infection with other STIs, etc. So what's important to understand is that different states and localities will or may not collect data related to transgender women or transgender men, depending on how they are reporting their data, whether they take into account sex or gender assigned at birth and current gender identity. So that's one thing to keep in mind. But for instance, I'm looking through my notes now to make sure that I'm giving you the correct information. New York City Department of Health, for instance, has really made a point of collecting data related to that. So asking what we call the 2 questions, which is sex or gender assigned at birth, and then current gender identity. Whereas I want to make sure again, with the CDC data, on page 13 of the report, you'll see that sex designations in the report are based on a person's sex at birth, and that transgender is an umbrella term that is used to identify persons whose sex assigned at birth does not match current gender identity or expression. So it's really important to know the differences in how that data is collected and reported depending on your geographic location.
Thank you, Gabriela. And there are 2 more questions for you. The Latino Commission on AIDS, how the organization arrived to the policies presented.
So the policies presented and how we arrived to them go back to our sort of 5-pronged approach to the model of services and efforts that we provide. So we take into account research and evaluation. We also take into account the input and the active participation of community members. And on the 3rd level, we also take into account like the resources, the infrastructure and structural determinants of health that are not necessarily equitably allocated throughout the nation, or considering the specific aspects of the territory, such as Puerto Rico.
Right. The following question is, how does the organization establish mobilization and advocacy efforts with organizations working in other states?
So can you repeat the question, Diana?
Sure. How the organization, the Latino Commission on AIDS, establish mobilization and advocacy efforts? Or how does Latino Commission on AIDS work with other organizations outside of New York City? I think that's the question.
Okay, great. Thank you for repeating that question. So the Commission has always, since its inception, had strategic and collaborative partnerships with national and local level partners, from grassroots organizations to foundations. And we, for instance, have at the state level an annual conference where we bring together different stakeholders, whether it's professional, community members, peers, to be able to dialogue about specific aspects of not just the epidemic, but social determinants of health and how they impact our communities. At the national level, we are actually funded by the Centers for Disease Control to provide CBA, or capacity building assistance, nationally. That gives us an opportunity to work with local CBOs across the nation and in the territories. We've worked with Puerto Rico. We've worked closely also with the Virgin Islands. And then one of our direct service programs is also funded by the CDC. So we're really lucky that we have such amazing partnerships at the national, state, and local level.
Thank you. And one last question for you, Gabriela, is could you provide the link to the CDC report that you referred to?
Sure. So if you look at the reference and resource slide that I provided towards the end, there is a link to the CDC surveillance report that I referenced. There's also the link to the New York City Department of Health surveillance report that I referenced, as well as the brief that I highlighted that we recently released at the Commission. So all that is available for you to download. It's free.
Thank you, Gabriela. And I think that concludes all our questions for now. If you have more questions, please email them to us, text us, put them in the box, and we will provide answers to those in the future. The next slide, please. Now, I want to remind you about the many ways there are to communicate with the Office of Minority Health. For more information about the Office of Minority Health, please visit www.minorityhealth.hhs.gov. Next slide, please. OMH wants to invite you to follow us. So there are many ways to connect to us. Next slide, please. And thank you. April is National Minority Health Month, a time to learn more about the health status of racial and ethnic minority populations in the U.S. The theme for 2018 is Partnering for Health Equity, which highlights partnerships at the federal, state, local, tribal, and territorial levels that help reduce disparities in the health and healthcare. Visit the new OMH website to download materials, learn about events, find out ways you can get involved with the National Minority Health Month this year. Thank you. Next slide. We want to thank our speakers in today's presentation and remind the public that at the end of this presentation, there will be a pop-up window for you to complete a short evaluation. Your feedback is valuable to us, so I encourage you to complete it. All participants who register for today's webinar will receive an email with a recording of the webinar. Thank you again for joining us, and we hope to see you again in one of our future webinars.